is up, everybody? Thank you so much for checking this video out. I'm Tevin Powers. I have here with me Aaron Miller, and this is going to be just a quick video regarding our movement expert concept series. This is just basically a case study is what I would call it. We're just going to break down a couple of things, hopefully provide a little bit of an approach for everybody. This was Aaron's idea, so I'm going to let him dive into a little bit more about why he wanted to do this and what we're actually trying to accomplish here, and then we'll jump into it.
Thanks, Devin. So yeah, I thought of this idea because I feel like we need to have something out there that describes the clinical aspect of what we do. We hear a lot of research and all these reports that we learn in school, and I think that the part that's missing from our education is the clinical skill and background on how to actually treat people and their cases and how they present. So this kind of offshoot of Tevin's podcast is something we like to coin the case-by-case series. And it's a thing we're going to hope to kind of continue in the future as we kind of have individual cases that come out, patients that we've treated, just questions how our thought process works and going through the whole treatment process to give others an understanding of how important the line of thinking is in treatment. So I think I'd like to jump in. And if you guys have any comments, questions, please feel free to reach out and ask along the way too, because we're all trying to learn. That's the purpose of this. So I'm gonna let Tevin dive in with our first case. It's one of his patients that he's gonna kind of update you on that, and we'll kind of play around with questions and kind of his thought process as he goes along through this particular patient. So I'm gonna let you, Tevin, kind of take the lead on that now.
So yeah, for this first case, I wanted to bring up something that we're all going to see. It's a very, very common, you can call it a sports injury, but you'll see it just in the general population as well. Just kind of an acute ankle sprain. I just wanted to talk about the progression, the approach, the mindset for this specific patient. Sounds pretty straightforward in the beginning. We just had a couple of scenarios and some kind of variables to consider for this specific patient. So just to dive in real quick, I had a 16-year-old female volleyball player, so she's a sophomore in high school, comes in with lateral ankle pain, just keeping it super basic as far as the description right now. I expected, after she told me she was in volleyball, I was like, oh, okay, she probably jumped, landed on it, and that's what our mechanism was. However, it was actually another student in her high school had a drawstring backpack on, and they were both going down the stairs together, and somehow the other student basically just kind of snared her leg, and she ended up falling down an entire flight of stairs, basically sliding all the way down to the bottom. It was a big dramatic scene with the ankle basically in a full plantar flex inverted position, just bent up under her. So she's compressing it, she's sliding all the way down the staircase. She wasn't able to stand on it immediately after immediate excruciating pain. And so during our testing, we noticed significant irritability. So this was a very severe, high sensitivity patient. So
can I jump in there real quick, Tevin? So just so that we all kind of understand where you're coming from. So what do you really mean by highly sensitive, highly irritable? Because that's something we hear all the time, but coming from you and your expertise, like, what does that mean when you see this patient? Was her ankle just like blown up and that's what you mean? Or kind of, can you describe that a little bit?
Yeah, absolutely. So sorry about that. So what I mean when I say that is there was obvious inflammation, significant compared to the other side. It's very asymmetrical. But when I say high sensitivity, severe sensitivity, what I mean is gentle movements, even in any plane. So dorsiflexion, plantar flexion, inversion, eversion, passive or active is very irritable. Every movement in every plane set off the symptoms in that same location with everything. And then on top of that, even with palpation or setting her up for grade 1, grade 2 mobilizations of the talocrural joint, the navicular, anything in the midfoot, the lateral column, anything like that would actually set off her symptoms that first session for us. So that's what I mean when I say highly irritable. Does that kind of answer that? Cool.
Thank you.
No, that's a great question. So first session, her concerns were she has a volleyball tournament coming up in 2 to 3 weeks, and she can't walk basically at this time. So that's one of the X factors I was kind of mentioning in the beginning is, okay, do I tell her that's not going to happen, or do we progress this to where she can function, but we know it's going to hurt like crazy, right? So
Yeah, that'd be my question, Tevin, is what do you tell this young female athlete who's getting pressure from her coaches, parents, whatever?
Yeah.
I don't know the whole backstory of that, but I'm sure we see it all the time. Like, what do you tell that girl who wants to play?
yeah,
I mean,
I think this is where we get in trouble a lot in even the general population or with our sports population is if we tell them they can't play, well, then they shut us out, they shut down. If we tell them, oh, you'll be 100%, then we're flat line. Sometimes you have to understand the tissue healing, the concept of tissue healing, what tissue is involved with potential traumatic injuries like this. And so then you can actually educate on the timeline. So for this patient, I said, hey, if we're not jumping, or we're not trying to run, we're not walking too much, we're not loading it too much, then maybe in 2 weeks we're 50%. Maybe by the tournament we're 50 or 60%. We can at least walk on it. But I made sure she knew there was probably a very low chance of us being back to full sprinting, full jumping, anything involved with the volleyball kind of sport specific activities there.
Okay.
Yeah, so where was I? So joint mobility testing, I'll jump into that.
Yep, good.
So talar curl limited with segmental mobility and dorsiflexion and plantar flexion. Again, I had to move super slow because of the sensitivity. Try not to cause more irritability with this patient. Inversion, eversion, extremely painful. Inversion also, a lot of guarding, eventually, I was able to do more precise ligamentous testing at the follow-up session, which kind of presented with the anterior joint laxity as well as with the calcaneofibular ligament as well. So we can suspect that tissue. So that helps me with the patient education later. Significant motor performance deficits with any foot intrinsics, with any plantar flexion whatsoever. And again, that can go back into the irritability. Part of me thinks she was trying to avoid it, and part of me thinks that there's other movement impairments that were there before the trauma happened that could potentially influence where this patient was. So, yeah, so just to kind of skip ahead in the timeline a little bit. So we actually had her able to do a full heel raise bilaterally at the end of 2 weeks. And that was immediately reversed almost a couple days later because she jumped into one of her club volleyball team practices and was pushed to the limit. So that basically puts us all the way back into the acute phase for our injury and what we're looking for there. So it was significantly sensitive all over again. We noticed an increase in the inflammation. And this is another one of the things, the anxiety for this type of patient. So she's trying to pursue a collegiate volleyball career. And now there's a lot of frustration, a lot of anxiety because the tournament is now in 2 days, I think we have. And she was just lit up by this practice. And so we go into our education. We did a lot of different low grade manual work, whatever she could tolerate to kind of, again, kickstart that healing process, keep soft tissue pliable, keep joints mobile. And I did back-to-back days at that point just to check on her. The amount of anxiety was just incredible. So I want to make sure she goes into this tournament knowing, hey, it's probably going to hurt. You need to kind of pay attention to how you feel. You're not going to be thinking about it during the tournament. As an athlete, you can't think about your injury if you're trying to play, and not playing was not an option for her at this time. So give her a couple of tools to use during the tournament.
Yeah, can I interject there and just ask? So she's flared up to the tournament in 2 days.
Yeah.
You know she's going to play. As her therapist, what do you do? And how do we educate our own therapists on telling athletes what they can do to combat maybe some of the stuff that we're doing? I'm curious to see what you did with her there.
Well, I go straight back to trying to understand tissue healing, trying to understand what tissues are involved. Do we need to go into more of the assisted joint mobilizations while she's on the sidelines? Can we have some kind of, I don't use a lot of modalities personally, but in this case, I went with an E-stim unit just to get some blood flow to the musculature in the area to try to limit the amount of inflammation there as well. Just educate what we're doing on the sidelines, educate what we're doing the morning of, the day of, what we're doing in the off time between games in the tournament.
And how she respond?
She actually was able to play the entire tournament, and that's 2 days, 6 games total. And and she said she felt significantly better because of the modalities, or not modalities, but the options we gave her
That's awesome.
to give her a little bit of control as far as her treatment plan went. Which was really cool to see. A lot of soreness afterward, obviously, a lot of pain afterward.
Yeah.
But she was able to do it. We were able to get through it, and now we're just on that track. She doesn't have anything right now. We're healing up really, really nicely. And actually, this is a whole other topic, but moving into more how do we address the movement impairments kind of up the chain that started whenever she got out of the boots, and addressing some neural tension and some of the more neurodynamic and control aspects of this patient's kind of picture here.
Great.
So, you know.
The last question I have for you, Tevin, is kind of, now that you've been and seen this patient and this young athlete for a while, what are you telling her prognosis is to, like, okay, you're
Yeah,
now
sure,
free
sure.
of me. What do you anticipate kind of in that realm of things?
Yeah. So again, this goes back to the timeline a little bit, but in a couple of weeks, I expect her to be much less irritable. Is kind of what I'm telling her at this point. She should be able to start progressing more into some single leg stability, where I think it's gonna be a little bit longer before we get into any plyometrics, or I feel comfortable with her performing any other plyometrics, because as soon as she got done with the tournament, she's telling me, hey, my heel hurts now, or on the back of my heel, whatever this thing is right here. She's pointing to her Achilles tendon.
Yep.
And so again, going back into tissue healing, we know now there's a reactive tendon after testing. We have to unload it. There's a whole other set of circumstances we have to consider with that. But then as long as that calms down, I'd say, 6 weeks, we should be almost 80 to 90% good to go. Probably another month before she's back to, 100%.
Great.
Kind of where I'm at with that. So
Great.
yeah.
Well, Tevin, I thank you for taking the time and sharing your case. I think there's a lot of great stuff to unpack with how his mind worked, how he managed the parents, the athlete, the care, because you're going to have people that come into your clinic who look like that and want to play that weekend, and you have to have some strategies, some ways to convince and educate your patient or athlete on how they're going to manage, because I think he did a fantastic job in the most important part in that early stage is educating your patient. He did a great job with that and setting the expectations, setting the boundaries, and giving the patient back some control, even in the event of a pretty traumatic and unstable, I guess, situation for that ankle. So I commend you on how you handled it, and I know that she's going to come back to full strength, and I appreciate you sharing with us. So.
Yeah, thanks for the questions, man, and thank y'all again for checking this out. I think we're all done for today, and
Yep.
we'll come back with more at some point. So keep
Case
checking
by
this
case.
out. Case by case. There we go.
All right.